you. Thanks, Claire, and thanks, Simon. Yeah, that was fab, and we've really enjoyed working with Learning Disability Wales. It's been a really good experience, and we've also had training of staff from Learning Disability Wales. So we're really hoping to have this easy read formats and just general increase in accessibility of our patient-facing documents in general. So it's a learning experience, and we're enjoying it. So in terms of the tramadol leaflet, so this was a leaflet we developed that was endorsed by AWMSG in 2022. And this was the first document we chose to develop for Easy Read. So when we say we developed it, it's really Learning Disability Wales that developed this and translated it. And yeah, like I said, the experience was really great. We were able to input at every stage, and we were really taught about the process. So as Simon said, these Easy Read booklets, they use pictures to support the meaning of text, and they're designed to help people with learning disabilities understand the information more easily. But also Easy Read is, like Simon says as well, is often preferred by readers without learning disabilities, and it can be really helpful for people who aren't fluent in Welsh or English as well. So it aims, this particular Easy Read booklet aims to give information for people who've been prescribed tramadol. So it aims that pharmacists and other healthcare staff and patients, families and carers can use the booklets kind of alongside conversations to talk through with that person about taking tramadol. So our next steps, really, we've talked about user testing a bit. So we want to publish these on the website, and then we want to get some feedback, really. So we're really keen to hear from patients, their families, carers, patient representatives, and pharmacists and other healthcare professionals that would be using these about their experience of using the booklets and what we can change and if they're useful, and also some advice on stakeholder engagement and and just feedback about how we can improve them. So this is our first Easy Read format of an AWTCC resource, and we aim to make Easy Read formats available for all of our resources that are aimed at patients and the public eventually. So they're also optimized for digital accessibility as well. So for example, screen readers. So I'll aim to I'll have a go at sharing my screen, and I'll show you the leaflet that's been produced. And what we'll do as well, we'll send this around after the meeting to the PAPIG group, so you can disseminate and get some feedback. It'd be really useful to have that that user test. So let me know if anything goes wrong with the screen share. Can everyone see the leaflet?
Yeah. That's
fabulous. Great. So this was the original leaflet that was developed by AWTTC and endorsed by AWMSG, and we reviewed it for plain English, plain language. But we're through our training with Learning Disability Wales and discussions with Simon, it's not enough. It's those pictures are so useful, and it's had really so I'll scroll down to the Easy Read format now. So this is what we had produced. Learning Disability Wales took this and took the information to put into the Easy Read format. So yeah, we've had some really positive feedback from the AWMSG members about this, and they're really glad that we're doing this and engaging with Learning Disability Wales and also All Wales People First. Have I got that right?
Yeah.
Yes. So we're really, we're really happy to be engaged with these people, and we're learning a lot. So this is the leaflet. We're going to have some QR codes added to this as well. So as you can see, there's pictures that really help do everything that Simon's been talking about. So we've got the white space, the language has been reviewed to make it simpler and just more easy to read. It's supported by pictures. And also, Simon can tell us more about these pictures, but they're stock images from a place that helps with accessibility, but they're also they're diverse, and they also look like real people and things that we recognise as well. So they got really good feedback at AWMSG as well. So as you can see, there's a lot of information, and one of the barriers and the challenges we had to overcome was medicines are complicated, and there's a lot of information that has to be included and sometimes can't be simplified in a way we'd really want to. It's a balance of kind of safety and making it usable. So yeah, there was a lot of discussion about this, and I think we've come to a really good balance here. So there is a lot of information in this leaflet still, but it's presented in a way that could be used with that person's carer or the healthcare professional to really help them understand what the medicine they've been prescribed is for and how they take it, and what the safety aspects of this are, and hopefully to empower people to, you know, have control of their medicines and help the, well, in this case, pain as well. So yeah, I'll just scroll through this, aware that we haven't got much time, but I'm really, yeah, I'd be really happy to send this out to the group and to get some feedback on this at any time. So I'll share my email as well. So yeah, we were really happy with this, and it was a good experience, and we're hoping to do more. I think the next one we're hoping will be the unlicensed medicines, which again is another complex concept and a lot of information. But yeah, we'll be in touch in due course. Thank you.